Welcome to our second Q&A session. As before, we have a long list of questions, but I'll be only focusing on 4 questions. I'm Dr. Saad Malik. Our first question is, a lot of them have asked, what does depression actually mean? A lot of people are confused about the word depression, and let me briefly talk about that. As a psychiatrist, in medical terms, depression basically refers to 3 situations. The first one is where you have a mood state which is normal, lasts for maybe a few hours and then subsides by itself. We all go through this from time to time. Occasionally you wake up in the morning and you don't feel very bright, but as the day goes you start feeling better, and that's about it. So one meaning of the word depression is a normal mood state which is not pathological, it is not an illness, it does not require treatment. The second meaning of the word depression is when you suffer a loss in life or a traumatic event, and as a reaction to that you become depressed. This could be loss of a relationship, this could be loss of a loved object, a failure in examinations, or perhaps, sadly, the death of someone very close to you. When we suffer one of these losses, we go through a normal reaction in which depressive symptoms are seen predominantly. But here again, the depression maybe lasts for a few days and then automatically subsides. It's more or less a normal reaction to a trauma, and there's nothing wrong with it. Here again, you really don't need a specific treatment. The third use of the word depression refers to a very serious mental illness which has a biological or a biochemical basis, in which there are certain chemicals in the brain which are reduced in their activity and in their concentration, and because of that, regardless of the circumstances, the person gradually sinks into a deep state of depression. This depression is clearly abnormal, it's pathological, it's a disease. Like you have diabetes, like you have hypertension, heart disease, in the same way, this depression is a medical condition. It requires urgent assessment and management, and it should not be confused with the first 2 meanings of the word depression. Many times we refer the word depressive disorder to clearly emphasize the third meaning of the word and distinguish it from the first 2. Depressive disorder is a disease in which there is a certain chemical abnormality in the brain, and you go through a very serious mental illness which, if untreated, can cause tremendous devastation. The most serious consequence of this illness is suicide. So please remember, when somebody talks about the word depression, you must clarify, are we referring to the first category, the second category, or the third? Many times we assume that people who are actually suffering from the third category, we think they just belong to the first or second type of depression and ignore it. And ignoring depression as a disease is extremely dangerous, because one of the most painful diseases that we have is suffering from the disease. The second question is from a lady who was asked, when should we decide whether we need counseling or when do we need medication? People are confused because some suggest that counseling can be therapeutic and others think it's medication. Some people are scared of medication because they think these medicines have lots of side effects and they are particularly habit forming. Now, we have to understand that different conditions, different symptoms, different problems merit different treatments. There's some people, let's say, who suffer from a sensitive, anxious personality or who have a problem in their marriage. Now, there's no point giving these people medicines because medicines will not change your personality and they will not cure your marriage. Here, counseling, either as individual psychotherapy or as couple therapy or marriage counseling, will help. On the other hand, if you have a serious mental disorder like bipolar disorder or schizophrenia or panic disorder, here, again, counseling in the acute stage or initial stage is unlikely to help. Here, because these diseases have a biochemical basis as their causation, they need medication. And depriving these patients medicines would be extremely unwise. Then there are conditions where both counseling and medication are required. Let's say if somebody is suffering from anxiety, what we call anxiety disorder. In the mild cases, the patient may just need counseling and he or she may benefit and recover in perhaps 2 to 4 weeks. If the same condition is moderate or severe, then the person may need medication to begin with, and then after maybe 4 to 6 weeks, you can add counseling and taper off the medication. So this is a situation where both counseling and medication are required. In most conditions in psychiatry, we need both medicines and counseling, one or the other to start with, and being replaced or continued with the other on the long term. So the answer to the question whether we should go for therapy or medication is it depends on your problem. There are some problems where medicine should not be given, and there are some problems where medicines have to be given with or without counseling. The third question deals with the problem of drug addiction, and the question is, what is the cure rate in drug addiction? Because there are a lot of drug treatment centers mushrooming all over the country who claim to cure drug addiction if the patient is admitted for 6 months or so. Now, let me explain to you that drug addiction, or what we call substance abuse, is something that the treatment depends on the motivation of the patient, the reasons why the patient is taking drugs, and the psychological and social basis that are behind the whole spectrum of the problem. The kind of drug treatment centers that we have here are basically unethical, they are unprofessional, and they really maltreat the patients. Most of these centers admit patients for 6 months. They don't let them see their parents or family. There's no proper psychiatrist, not even an ordinary doctor or psychologist. Sometimes they are subjected to severe violence, and at the end of 6 months, the cure rate, if there's a cure rate, is no better than anywhere else. Tragically, substance abuse is one of those medical conditions where the cure rate is rather low. But before we discuss that, we must understand what do we mean by cure. Generally, cure means that once you are treated, you will never become ill again. Now that is very rare with substance abuse. I think the maximum recovery rate for that category is not better than 10-20%. The rest of the patients relapse and they have to be helped again, and in many cases the problem continues. If the patient's motivation is well developed, the family is supportive, and the factors that trigger the drug addiction problem and the factors that perpetuate the problem are not there, then again the recovery is better. I would strongly suggest to you that you should go to a drug treatment center which is either in the government sector, not that they provide the best treatment, but at least they have a certain standing. But the private ones where they lock you up for 6 months and don't let you see the family, they are completely unethical and should be avoided. The last question is, which is a question that I've come across countless times. Dr. Saab, do only mad people go to psychiatrists? Now, this sadly is a view that despite so many years of advances in psychiatry, people in this country still hold. I think if you go to any psychiatry clinic or to a psychiatric hospital, you will notice that 90% of people who have come there are people like you and me, people who are having problems in their life, people who are having problems with certain biochemical mental disorders. But that concept of a mad person is extremely rare. We don't see that anymore. And most patients are there because they're having problems with life and problems with certain conditions that they're unable to handle themselves. At the same time, there's a new concept in psychiatry in which I am particularly involved, and that is teaching people how to live. That again is in the domain of psychiatry. We spend a lot of time in our life learning how to make a living, but we never spend even an hour on learning how to live. We have no idea what are the do's and don'ts of getting married. We have no idea of what are the do's and don'ts of bringing up a child. We do not know how to handle communication, how to handle job stress, how to handle relationships, how to manage conflicts, how to manage time, how to have a meaning in life. These are important issues which again are in the domain of a psychiatrist. You don't have to be mentally ill to see a psychiatrist or mad. You can be a perfectly normal person who needs a coach, like you need a coach in the gym. You need a coach in the mental gym who can guide you through the vicissitudes of life and help you through it and develop your higher thinking and develop your faculties which otherwise will remain blunted and undetected.